Hi, I'm Dr. Robert Moore, and I want to talk with you about the long-term effects of stress on your body, how it alters your brain and the physiology and the physical function of your body. About 25 years ago, I had a wakeboard accident. I tore my right ACL and my right medial meniscus, and I had two surgeries, one to repair the meniscus, and when I woke up from that, my leg was in a brace for about 8 weeks. I couldn't move my leg. And I also had ACL reconstruction probably about 5 months after that, and then did all the rehab. So I want to show you the effects of what my body has changed. And I just noticed this last year at the gym. And so I want to show you this because it's very interesting. Okay, so hopefully you can see this, but this is my left calf. This is my right calf. And I believe you can see the difference in the size. This one has more definition than this one. You can also see here on my left knee, here's the scar for the tissue and the little dots there from the surgery. But you can see the difference in the size. This one is 5/8 inch bigger than this one. So you can only imagine what I feel when I walk and the difference in that. It's very visible to the naked eye. Hopefully you can see this on the video. All right, well, that's pretty interesting. There is a 5/8 difference in my left calf versus my right calf. So why would this happen? That's what's interesting. I didn't see this right away, but long-term stress will destroy your body. So we have to remember this. When I injured my leg, I changed the physiology and the way my brain saw my leg, because I'm missing the ACL. It's torn in half. My medial meniscus is all ripped up. And so that changes the left side of my brain, what's called the homuncular area. You can look that up. It's called the homunculus. We all know that there has to be a part of my brain for my right knee, and that's going to be over here, and that's going to be also in my right cerebellum. And that area relies on neurological input. You change the neurological input, you damage the neurological parts of the brain. And so then I had surgery. And we all know this. When you have surgery, you don't walk out the same. They're going to cut some nerves. They're going to cut some tissue. They're going to damage some tissue. Yes, I can walk right now. I don't really enjoy running, but I can walk and I can do a lot of stuff. But the surgery also contributed to the breakdown of my nervous system. Now, what's interesting on this is my nervous system, my brain, my parietal lobe, my frontal lobe, my cerebellum, all the parts of my brain have to work together to tell the muscles in my calf to heal and rebuild. When I was in the brace for 8 weeks, I was not getting much information to my brain, and my brain feeds on neurological input. Your brain loves oxygen, fuel, and stimulation. And when my knee's not moving around or my leg's not moving around, I'm missing the stimulation. So it's not really good for my brain, and my brain suffers. And so what does that do? That causes long-term damage, and as I'm healing and rebuilding and repairing, I'm not doing such a great job on my right side as opposed to my left side like we showed in the video. And so what can cause this in you? Not just, rip your knee apart, get 2 surgeries. Knee replacement will do that. A hip replacement. Other surgeries will do that, because we know when you have surgery, you damage the tissue of the body, you damage the neurological input to the brain, and that's going to change over a long period of time the way the brain sees the body, and that's going to change the way your brain heals. Chronic use of medication, that will do the same thing. That'll be more of a systemic thing. The standard American diet with leaky gut, with inflammatory bowel disease, with all the nasty stuff getting in your body and aggravating everything, the lack of nutrition, malnutrition from maybe dietary supplements that you use to lose weight. Those will change the neurology of your brain, which will change how your body looks, feels, and functions. There's also stress, physical stress, chemical stress, emotional stress, sitting down all the time. That's the new smoking. We call sitting the new smoking. Lack of stress is also what will also do that to you. Then there's what we like to call a healthy body. If I injure, you can understand this, because my right calf is about 5/8 less in size than my left calf, that when I walk 5,000 steps a day, it's going to affect everything else in my body. It's going to affect my brain. It's going to affect how I function. And you can just imagine that my left leg has to compensate for the inability of my right leg to function. So I'm prone to more injury with my left leg. That's easy to see. There's also, if I have any other surgeries and I can't breathe properly, maybe I have COPD, I'm not getting fully oxygenated blood, so now my brain suffers because of that. If the quality of my blood, I'm not getting good nutrition in my blood, I'm not getting the right nutrition, the right nutrients that I need, my brain's going to dysfunction too. And so that's going to have a big effect on my physiology, what I see, what I hear, what I feel. And there's what we call the AEIOU. There's autoimmunity, which you just destroy your body from the inside. There's excitotoxins. We live in Michigan, and I like to call the big three, the nice toxifiers of the environment. So excitotoxins. So you better have a good working nervous system, better be able to adapt for that. There's also inflammation. When you're overweight, that's chronic inflammation. When you have fibromyalgia, maybe COPD, maybe you have even autoimmunity will cause chronic inflammation. That destroys your nervous system. Your brain absolutely does not like inflammation. Then there's the O. There's AEIO, which is oxidative stress. That is all the stuff that we go through our whole life. Maybe your relationships aren't good. Maybe you're stressed out at work. Maybe your spiritual life, you don't have a good relationship with God and you're lost. And so I would suggest find a great church, talk to Jesus, and you'll get back on track. And then there's the U. That's called the uncoupling of the mitochondria. It's kind of like this, having a dead battery in your car, having low energy because inflammation, oxidative stress, all of those things destroy the mitochondrial function, which is designed to give you the energy to heal. So if you have all that stuff going on, you're not going to work so well. So in our office, we take a multivariate approach to your condition. We look and we see, okay, where is the problem and what other factors of your body, what are you doing in your lifestyle to address that? Because here, the simple truth is this. You can see on my legs, there's a difference there. I didn't really realize that till just recently. I should have realized it a long time ago. I'm not surprised by it because I understand the neurology and the physiology. And so if that's happening to me, it's happening to you and it's happening to a lot of people. And we don't know. We're not going to correct my legs. They're not going to be corrected. We're going to optimize the function though. We can correct some things. We can optimize the function of things. We can keep things at bay, and we can maybe just slow down the degeneration. That's what we do in our office. We look at you, we try to figure out what's going on with you and help you the best we can. So I hope you got something out of this. It's kind of eye-opening. It was eye-opening to me. And I want to say thank you. God bless you. Call our office, 810-374-0304. We'll be glad to help you out. Your first exam is a donation to charity for the exam and the x-rays. We found if we can help you. So have a blessed day. God bless you.